January through March, Medicare Advantage Open Enrollment. What is it? What is it for? What can I do? Am I eligible? Who does this apply to? Hi, this is Kathy Bukowski, the owner of CB Health Insurance and the CB Health Insurance YouTube channel. In today's video, we're going to answer what is the Medicare Advantage Open Enrollment and who does this apply to? If you're new to our channel and watching for the first time, don't forget to subscribe, hit the little subscribe button, and check the little bell so you get future notifications when we release new videos, which is about twice a month. Don't forget to tell your family and friends about our channel and give us a thumbs up if you like the video. Now on to today's video. Every year there is a Medicare Advantage Open Enrollment when Medicare Advantage members, those are people who are currently enrolled in Medicare Advantage plans, can change their plan or they can leave Medicare Advantage and go back to original Medicare. So again, this is an annual open enrollment for people on Medicare Advantage. It is not for people who are not on Medicare Advantage. Who would that be? Well, that's going to be somebody that's on a Medicare supplement. If you have a Medicare supplement and Part D drug card, this is not for you. This Medicare Advantage Open Enrollment, you will not be able to enroll or do anything, okay? It's only for people who are currently enrolled in Medicare Advantage. So now that we've got that straight, phew, when is this? Well, it's January 1st through March 31st every year. Okay, and this has been going on for a long time. They used to call it the Medicare Advantage disenrollment period, and there was a time it didn't exist, but it's been around for a long time. And one thing that's very important about the Medicare Advantage Open Enrollment is you get one election. That's it. So it's different from the annual open enrollment period for Medicare, which is in the fall, October 15th through December 7th. You can change your plans as many times as you like. So if you wanted to make a change on October 15th, which is the first day, if you want to change something on November 2nd, and then the end of November, and then December 7th, the last one sticks. However, that is not the case with Medicare Advantage Open Enrollment. January 1st through March 31st, you get one election, one time only. One get out of jail card free. So that's really important. Now, what can you do during this time? There are two things you can do. Okay, the first thing is you can change your Medicare Advantage plan. So why would you want to do this? Well, let's say you enrolled in one for the first time and you later find out your doctor's not in that network, but oh, by the way, they're in a different plan. You might want to change so that you can see your doctor, or you want to change because there's more providers and more options in a different plan. That's one option. You might find out that, hey, there was a new plan that was available. I didn't hear about it. My neighbor enrolled in it. They have better benefits. She's got these fabulous dental benefits, and I want that plan. So you can switch because you want to get better benefits, and that's not a problem at all. Last but not least, I think some people are, in Medicare Advantage is managed care. It can be HMO or PPO. There are fee-for-service, although we don't see them as often. And what some people want to do is switch from an HMO or a fee-for-service to a PPO. Why would they want to do that? They want to have access to more providers. They want to be able to go to the doctors that they choose without having to get a referral. So there's a lot more freedom in a PPO. And oh, by the way, there's a lot of PPOs out there. So, you might be shopping for a different plan for a number of reasons. One, your doctor's not in it. Two, you want better benefits. Three, you want to have access to more providers, or you want to be able to go to XYZ facility and they are not in your current plan. So you can switch. So that is the first thing that you can do. The second thing you can do is you can leave the Medicare Advantage and return to original Medicare. What's original Medicare? A and B, and you get a drug card, Part D. And we highly recommend that you also get a supplement. So remember, when you get your drug coverage, you get it one of two ways. You either have Medicare Advantage with prescription drug coverage, which is Medicare Part C, or you do Medicare Part D. You can't do both. So there's really two steps to leaving Medicare Advantage and going back to original Medicare. Step one is finding drug coverage, right? You can shop for a standalone Part D drug card. That is guaranteed issue, super easy to do. And once that application goes to the carrier, it actually has to go to CMS, the Centers for Medicare and Medicaid. They govern all the Medicare plans. They're going to disenroll you from your Medicare C and enroll you in the D, because you can't have both. You get one or the other. However, there is a second part to this, and the second part is getting a supplement. Now, a Medicare supplement is highly recommended. We recommend don't just have Medicare. I did a video on this, and it will go through all the gaping holes. But there's a lot of things not covered, and the supplement will pick up those things that Medicare doesn't cover. The deductible for hospitalization is over $1,600. There's a 20% coinsurance, so it's highly recommended that if you go back to original Medicare, you have a supplement. Here's the problem. It is not guaranteed issue that you can get a supplement. Outside of your initial enrollment turning age 65, there's a 6-month window. So what do you do? Outside of the initial enrollment, insurance companies can ask you medical questions, right? And decide if they're going to accept you or not accept you. So you'll want to fill those questions out first and submit the application to see if you're going to get approved. Now, there are some states across the country that do have carriers that offer a guaranteed issue policy. There are certain rules and regulations you have to check with your agents, a licensed agent in your state. In the state of Illinois, where I'm located, we do have a carrier that is guaranteed issue at any age. Blue Cross Blue Shield of Illinois has a guaranteed issue product and has as long as I've been in business, over 3 decades. I would recommend, depending on your health, to try to apply for one that is underwritten first, because those premiums are going to be lower. Anything that is guaranteed issue is going to be a much higher premium because they take everybody regardless of your health. So that's going to be step one. You'll want to do that first. The drug card is guaranteed issue and you can do that later. So remember, when you're switching, you have this window, you have one election, and it's from January 1st to March 31st. If you make a change in January, the month of January, your new plan, if you submit an application, for example, for Part D drug coverage, will go into effect February 1st. If you apply in February, it will be March 1st. If you apply in March, it will be April 1st. But remember that Medicare supplement, you want to do that application first. And the Medicare in the underwriting should go pretty quickly, but it can take a few weeks. So I would caution you to do that first and don't wait till the end of the Medicare Advantage Open Enrollment period, the end of March. Do it sooner rather than later if you do want to return to original Medicare. So in summary, what is the Medicare Advantage Annual Open Enrollment? When it's a period when people currently enrolled in Medicare Advantage plans can make a change to their Medicare Advantage plan, or they can leave Medicare Advantage, go back to original Medicare with Part D drug coverage, and we recommend you buy a supplement as well. The timeline to do this is January 1st through the end of March, March 31st. You have one election, not multiple times, so plan accordingly. And you do, if you have any questions whatsoever, you should talk to a licensed agent in your state. Feel free to contact our website. You can go to cbhealthins.com, fill out the form. Our office would be more than happy to shop and help you pick a plan. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.